everyone. This is Milan Šveřepa from Inclusion Europe. Welcome you to another of our online exchanges about the situation under the coronavirus emergency for people with intellectual disabilities and families. And today we'll be talking about France and what the situation is like in that country, and especially what our member Unapei is doing.
Is now joining.
And so allow me to welcome our two guests today, Isabelle Chandler and Clara Alibert, who both work for Unapei and who will talk to us today about the situation in France. And to start with, if you could please introduce yourselves briefly, Isabelle.
Yes. Hi, everyone. I'm very happy to join the meeting today. I'm here from Paris. Clara is in the Drôme in the south of France. And we have been working home for the last 55 days because we were in lockdown in France. But we are belonging to Unapei. I am the director of public affairs in charge of territorial public affairs, national, European and international public affairs, with a great team in Paris and of 5 people. And we are a member of Inclusion Europe, happy to be a member of Inclusion Europe, active as we can. And we are very happy to be here today because we have been living through a difficult period and we would like to share our views as usual. We just met in Paris just before the lockdown. It was on the 5th and the 6th of March in Paris. I was sick, actually. I could not join. I do not know what kind of sickness it was, but I was very sick. But so fortunately, I was not with you. But Clara was there, and I think it was a great meeting, and we were very happy to have you there. So please, Clara, introduce yourself.
So hello, everyone. I'm Clara from Unapei, working as an advocacy officer, and I'm really happy to be here, and I hope everyone is safe and feeling fine. And again, thank you, Inclusion Europe, for the invitation.
No problem, of course. We are happy to have you. It's true that our last meeting where we are able to see someone face-to-face was in Paris just a week before both Belgium and France went into lockdown, which is now, as you said, 2 months ago. Can we start by, can you give us an overview of what the 2 months have been like? What the main problems have been for people with intellectual disabilities and families during these 2 months?
Yeah, yes, we can start with that. Actually, just to give you another view of the calendar, we have been, since the last 2 days, we started the end of the lockdown, but we have been in lockdown the last 55 days in France. So that is to say now that the people can go out without authorization, and you will see it's a crucial point to have an authorization or not to go out for all the people we are representing. So now the people can go back to work even if most of the people are working from home, and that's the rule actually. And so we started a new time in the management of a crisis right now since Monday. So what have been the main problems for people with intellectual disabilities, for their families, of course, during the lockdown? We can say that the people with autism spectrum disorders, for people with intellectual disability or with mental health issues, the quarantine was very hard to manage. And this period actually even lead to other disability. And that came back from our network. Actually, just to give you another view, we are supporting 200,000 people with disabilities. So it's quite big, the community we have. And this community is also settled in overseas. And as we see, the pandemic hit mostly the east part of France. And fortunately, overseas, it was not good, but it was not so hard. So we had people with undergraduate, and actually we have been supporting 70,000 people undergraduate. The measure that applied to them during the lockdown favor the reinforcement of many obstacles to their daily needs and to the respect of their rights and their very fundamental rights, actually, the access to food, the access to health, the access to education. So it was a very big issue, and we had a big conversation and discussion with the government about that. Actually, as well, people with psychic or intellectual disability also have great difficulty understanding the situation and the condition of the lockdown, which was quite strict, because, you know, we could not go out more than 1 hour and not 1 kilometer far away from home every day. So it was really strict. And so people, so as a result, some people started to accumulate fines because they live without adequate authorization. And due to the financial situation, that could have been very problematic, because the fine was around 135 euros. And you know, the minimum allowance, the disability allowance is about 900 euros. So actually, the law enforcement officials were not trained for this situation and to understand the specific difficulties of these people to understand the condition of the lockdown. Of course, to continue with this, the closure of post office and bank in particular in rural areas, made very difficult for the people undergraduate to withdraw cash. So they had very big difficulties to get cash and to be able to pay for their food. So that was also a point we advocate for the shops to accept cash. Or no, not to accept cash, but for the people to get foods. It was very difficult. What else? Due to the closure of day center services during the lockdown, many of the persons carried out by support services provider were carried out by a support services provider, but all these people went back to their family, and of course the family, as in every country, they suffered from burnout and they are exhausted physically and mentally. And so it was quite difficult for them and for the people, of course. So now we are back to the usual life, but not in the usual conditions. And it's the first week actually where everyone can go out, can go back to work, can go back to school. And we are managing the return to school and to work for the people with disabilities. We don't have an overview right now of what the situation is, but actually it's not much better than the weeks before. So we are returning little by little to the usual situation, but most of the people with disability are not back to school, and most of them are not back to work. I mean, the one who are working in for example, in shelter workshops, they are not back to work.
To pick up on two things you mentioned there. First, about people who live in residential services. So I assume, like in many countries, they were, like you mentioned, that some of the families took some of them at home, But for the others, where they're basically isolated, or are they still isolated this whole time, like it is in many other countries, without, in many cases, without even the virtual online contacts with anybody? Like what is the situation for people in residential services?
Yeah, we have to mention that due to the government directives, some of the residential institutions, when possible, remain open. And of course, we had to apply some security directives to avoid contamination. Regarding our network, I would say that 1/3 of the residential institution remained open, and we had contamination of people during this period, of course, and actually 300 people with disability have died during this period, not in our network but globally. I just want to remind you that in France we had around 26,000 people dying from coronavirus. So 300 people with disability have died, and we will come back later to the issue. But I can speak about that right now. We had a big fight against discriminatory access to health, and so the people in residential institution, some were sick. We take care of as well as we could, but at a certain point they were not accepted into hospital. And Unapei in Paris, we had to denounce this fact, this discriminatory access to care and to hospital for people with this intellectual disability, to the media. We alert very early on, actually on the 23rd of March, about dramatic situation we heard about. We spoke to the media. We alert that on the social networks. The minister Sophie Cluzel, in charge of persons with disability, told us that we put anxious spirit into our country because of that, which is incredible. But actually, we advocate in collaboration with a collective of NGOs, or 48 NGOs and associations in France. And so we did that, it was around the 25th of March. And on the 4th of April, because it was clear that people were not accepted in hospital, the Minister of Health, Olivier Véran, and the Minister in charge of persons with disabilities had a common press conference for persons with disability. And it was quite interesting because nobody spoke about the person with disability until the 4th of April. Mm-hmm. We had the lockdown mid-March, but they did, it was the first time we had a common press conference, and the Ministry of Health, Olivier Véran, reiterate the of series of measures to make sure that this situation will not happen again. And we know that they happened. So actually, after the press conference, the situation, in our understanding, get better, even if we still remain very vigilant, and we will remain vigilant in this new period. But it was a very difficult point we went through, and I'm sure all of you went through this situation.
This was I think an experience, unfortunately, in many other countries as well. But it's important that you succeeded, let's say, quite early on to getting the advocacy efforts out, and then getting the ministers to address the issue. I think it's because just to comment briefly on what you mentioned there, the people with disabilities were sort of non-present before it in many other countries, they are non-present until today. Basically, they they are not being addressed in any sorts of communication properly. So it is of course important to that it was addressed, let's say, earlier. To go back also another thing you mentioned in the remarks before, and that's about education and what was the situation like with schools? We had some reports saying that France actually had provided some, let's say, distance support and distance learning to children with intellectual disabilities as well. So what was the situation, or what is the situation now in regards to schools?
Yeah, maybe Clara will intervene on this point.
Yeah, sure. Well, since the beginning of the lockdown, schools are closed for everyone. So the government tried to implement digital support for every children with or without disability. But what happened is that we observe in France a digital gap between families. So it was a big point that the government worked on to provide computers, tablets, and all this. So that's why many families and many children cannot attend to this digital school because they can't access to the digital tools. So that was a big point. And then for children with disability, more particularly, sometimes they can benefit from specific tools. However, most of the support was provided by service providers, and even if the government tried to implement tools, it's true that for our understanding, it was more, for example, Unapei network who provide digital support to caregivers in order for them to accompany the children during the lockdown. And for our understanding, also, even if they try to provide support, the information wasn't always accessible for all kinds of disability. So it was also a point that was raised by the many organizations representing persons and children with disability, because some content wasn't accessible for every disability.
Yeah,
and just
actually,
yes, about.
Actually, just to we the schools, the ordinary schools and the special schools, and actually the crisis put an emphasis on the differences of support that children in ordinary school can get, and it's not good. And I'm not advocating for specialized school, not at all. But the point is that the system is not providing specific support to children in ordinary schools and children with special needs, and that was not good, not at all. So we have really to learn from that and to accompany to work with the ordinary school to make sure that they are providing better support to children with disability, for sure. Sorry for that.
Well, I think it's of course an important element of the situation, and I think as in many other aspects, what the emergency is doing is kind of highlighting some of the existing issues. I usually say there is nothing new about the discrimination or the problems now. Mostly this is, let's say, making them more pronounced, making them more extreme, of course, when it becomes to issues like healthcare. But I think that's the same as the same situation here. It's about making more obvious, let's say, the lack of support for children in mainstream schools. So thank you for highlighting that as well. Just briefly, last question on schools now, because in some countries we observe that schools, especially special schools or special classes, have been left out of the reopening. Are schools being reopened in France for everyone, or is there, so let's say, some sort of unwanted exception for children with disabilities?
No, actually, the ministry, Sophie Cluzel, the ministry in charge of people with disability, said very loudly and everywhere in the media that the children with disabilities should go to school, and it's a priority for school. So it's what she has been saying, but the reality is that, like every parent, the parents of children with disability does not want children to go back to school, at least 50% of them, okay? And it's exactly the case for every parents, okay? So 50% of the children are not going back to school because social distance is difficult to ensure, because we have been hit very hard by the pandemic, for example, in the area of Paris, in some area in eastern France, and in some area in the north of France. So in these kind of areas, the people are scared, only scared. Yeah. And also because, as I said before, the schools are not ready to support the children with disability. And so the parents, even if they are quite tired and in a kind of burnout, they do not want their children to go back to school. That's one point. And when they want their children to go back to school, actually, we are in the first week, of transition. So some schools are not ready. And so there is a kind of transition right now. But and actually, we are almost at the end of the year as well. So there is still 1 month and a half of school. So I think some children will go back to school gradually. And but it will be the end in 1 month, actually. So and what we are actually working on right now is some respite solution for children and for parents, and it actually, regarding respite solution, it has been very difficult to organize them during the lockdown because the government put very strict condition on it. It said children could go back to school, to some daycare center, but only 1 week or 2 weeks, and not 1 day or 2 days. So now I think it will be easier to find some respite solution just for a few days, because before it was not possible. So that's one point which is better right now for the parents who are really tired and who could not go on to support their children.
Let's maybe you've mentioned the response of the French government and how the ministers got involved, and of course there are many things to be critical about and to stay alert. But I want to specifically highlight that observing the situation from the European perspective, France and the actions of the government kind of stood out in some respects in the positive way by providing quite a good amount of, let's say, accessibility measures when informing people, including producing the easy to read versions of the documents that people needed to be able to go outside and other things. let's stay on the positive sides. What are, and because I
Yeah.
think it might be also interesting for others in other countries what they can learn
Yeah.
from this. What are the things that you appreciated from how the government kind of took into account and what they did for people with intellectual disabilities and families?
Yeah, you're right, Milan. First of all, I would like to mention that the cooperation with the government was good at this time. Okay, and it was good generally, basically speaking, you know. We had every week a conference call, all the association with the minister, and every difficulties we mentioned to her was taken into account. Okay, so that was the very positive side of the crisis. And government are making information accessible. That's very true. Every presidential or minister statement is now accompanying with transcription and sign interpretation. That's a very good point. And regarding easy to read, our associations, and we are a network of 550 associations all over France. They worked a lot to develop ETR documents. And for example, they developed an ETR version of the official authorization to go out during the lockdown, because, you know, we were one of the country and maybe the only one who had an official authorization to go out during the lockdown. We had to write down every day, if we wanted to go out 1 hour, we had to write down the authorization. So we did this kind of authorization. We did an ETR version, and it was sent to the government. And thanks to the collaboration with the government, the ETR authorization was disseminated in all France. And it can be used by every people with disability in all France. And so there are lots of media on that. So it was a way of popularizing, of making that more popular in a way. But during the lockdown, we had some cases of policemen who did not accept the ETR authorization as an official document. So again, we had to alert the government about this situation, because it's a never-ending situation. If you get to a good point, then you get to a bad point, okay? So because generally speaking, the law enforcement officials were not trained about the ETR, and many public servants were not also trained about this version of the authorization. But actually, before the lockdown, and it was actually 2 years ago, we developed a strong collaboration with the National Gendarmerie, the people we check out the authorization, to sensibilize them about the ETR. So we could use this way, and we advocate, and we advocate again. And we reach out again to the gendarmerie and the national police to tell them to make sure that the forces are aware of this authorization. So there was actually a territorial inequalities about that, but okay, it was a good point in a way. Let's say that.
No, I definitely, and I think also it's worth highlighting what you said there, that in a sense, this also helped to kind of raise awareness about easy to read and accessibility in general, because the government was using it, the media paid attention, so that's also an important element of the situation. And looking now at where we are now, and when France, what kind of direction this is going to take, what do you now see as the main issues and challenges for the near future? What is your focus now, and what you anticipate that you'll be working mostly? What kind of issues you will be doing your advocacy work now and addressing?
Yeah, I give the floor to Clara, maybe.
Yeah. Well, as Isabelle said at the beginning, Since today's we end the lockdown period, so we are beginning a new time, and it's going to be a very stressful period for persons with intellectual disability, for their family, for their caregivers. So of course we are going to be here to support them in a concrete way and also in an individualized way. But we advocate, before the end of the lockdown, we advocate a lot with other NGO and organizations to, we wanted the same deconfinement, the same end of lockdown procedures for all citizens. We didn't want the government to make a difference between person with disability and a citizen without disability. We wanted that disability should not be taken as a criterion of vulnerability. So we wanted a non-discriminatory access to the end of lockdown, but of course this means that we need to access to protective equipment, we need to access to tests for all professionals working with a person with intellectual disability, for caregivers, for teachers, because without this kind of equipment, there is more risk to contamination. So we will be very careful of the provide of equipment. We also will be very careful about the access to health in general, the routine care. Many of persons with disability during the lockdown couldn't access to daily care. So now they have to go to doctors, to hospital in the more normal way. So we are going to support them in this démarche. Also, we are going to be very vigilant, because if there is a second wave of contamination in France, we are scared that the discriminatory access to hospital will happen again. So we remain very vigilant about this point. And of course, something that we're scared of is the economic crisis, because we all going to face this crisis, and unfortunately, people who will be more affected again is a person who are already facing a lot of inequalities. So we are going to advocate to don't cut support and to continue to support the correct accompaniment of persons, and to provide, of course, money to do this. And that's it. I think there is many challenges, but
okay, thank you very much. Thank you both for giving us the overview of the past 2 months, and thank you, of course, for the work that you've been doing. As I said, it was also for following Unapei's work, because it provided quite some good examples of stuff that could be used and reproduced elsewhere. And let's now open the discussion to the other participants. So if anybody wants to raise any questions, you can either use the chat function that you will find next to the other control buttons on the screen, or you can unmute yourself and come in directly over the microphone. So please do not hesitate. We can deal with some people talking over themselves, that's normal. But if you want to come in, just unmute yourself or type in the chat. Yes, Jirke?
Yes, good morning, everybody. Nice to see you again, and thank you for your hospitality in Paris in 2 months ago. It's a long time ago, and actually, as Milan mentioned, it was the last time we have seen anybody, actually, because I've been in my home all these 8 weeks. But anyway, very interesting to hear, and sad to hear about your situation, of course. What interests me, has been very interesting during this period, is that we don't have any statistics on people with intellectual disabilities who have been infected by the virus and who had died. We don't have any statistics in Europe, but you mentioned anyway that you know that 300 people with intellectual disabilities have died in France. Do you have any Is this just one figure, or do you know that there are lots more?
Excuse me, Turkey, I can't hear the last words, the last sentences. Can you repeat it, please? Sorry, I was
Yes, I can repeat. You mentioned the number 300 deaths in coronavirus with people with intellectual disabilities. Is this just one number, or do you know that there are many more also who had died?
Actually, these are the people who died in at hospital, and not the one who died at home. And actually, we don't have any figures regarding France from people dying at home. The global figure is 26,000 people who died of coronavirus, but these are the people who died at hospitals. And,
yes.
and among them, 300 are people with disability. But that's the only figures we have. And I think the government will deliver figures of people who died at home, but it's difficult. They will try their best, but it's difficult.
Yeah, I have also asked our authorities here in Finland. Nobody knows. There are no statistics anywhere. The other thing I would like to know is how are your families now?
How what?
How are your families doing?
Actually, they are not in good condition. They are, and it's the reason why we are developing respite solution everywhere, and we are very keen on also developing rapidly solution for vacation actually for them, because they need, and with of course specialized support, you know, because they really need to go out, and they need to be taken in charge, and the people need to be supported. So we are working very hard on that. Actually, now every person can go out of his home 100 kilometers away, you know. So it's quite restraining right now, and we do not know what would be the situation like everyone in July and in August. For example, in some areas, for Corsica, which is an island, they said that they will not accept any people who did not have the coronavirus, you know. So it's quite unclear right now, the situation, but because we have many facilities, we will make sure to open these facilities to everyone 100 kilometers away who needs us, you know. But that's the point right now. But you know, they are tired. Some are into a burnout situation, and also they saw that through this crisis again, the general population isn't sensibilized enough to the intellectual disability, and we see that they are. It's a hard point for them, because they went through a very difficult situation. And at one point, the government did hear them, because they were the only one, the people with autism were the only one who could go out like they wanted during the lockdown, you know. The lockdown was eased for them on the 2nd of April, because it was too difficult for people with autism to stay at home like that. But generally speaking, they were not taken into consideration as they should have been taken into consideration. And that's also a point for them, that they are invisible in a way. And that's also our point, Unapei, that we will make sure, and what we learn from that we will make sure that they are visible, and we are fighting for the visibilities and for the difficulty of the situation, to make sure that people are understanding the situation. And that's really one point we learned from this crisis again.
On the subject of families, and you mentioned earlier that one thing is, let's say, providing respite or vacation support or something, so they can take some time off, which is incredibly important at this moment. But you also mentioned that parents are reluctant to kind of allow their children to go back to school because they fear for health reasons. I would imagine that might be the same with the social services reopening. Is there anything in particular that you are or in your networks organizations are doing to address the, let's say, alleviate the fears and to provide people with some sort of assurance of the safety and the value of using the respite, actually overcoming the fear?
Yeah, but you know, it's specific for children. So, but it's half. You know, the fear of going back to school. It's half of the families are feared, half of the families are not feared. Regarding social services, I think that we are valuing a certain confidence into our social services. And because we did well during the crisis, and we did very well, actually. I don't want to say that because it's Unapei, but we did quite well. And so we are keeping on this confidence, you know, and because now we also have protections, because at the beginning of a crisis, like Clara mentioned before, we did not, the professional did not get the protection, the material protection, but now we have it. And actually at Unapei, we also import some masks and protection from everywhere we could. And we also were supported by many people on the territories, you know, private, public institution give us masks and all the material protection. So now this issue is not solved, but this issue is behind us, the issue of protection. So the confidence is getting better. And also because we the people who were not in families, but in residential institution were protected in a way. I'm not for residential institution. I'm not saying it's good, but because they were protected, the confidence is here. So it's easier now to work with families.
Okay, thank you. Let's take one or two last questions before our time is running out. So if anybody wants to come in, please unmute yourselves or post a question in the chat.
There was a question in the comment section.
Yeah, there was a question from David saying, I'm wondering for statistical reason, do they know what the medium age of the poor 300 fatalities?
Do the media knows about the people who died?
The question, if you know anything about the age of the people, 300 people who died?
No, I think they were quite old, but we don't have statistics about that. Yeah,
okay.
but most of them were adults, for sure.
Yeah.
Okay.
And regarding this statistic point, before the crisis and during many years, we advocate to have statistic, and now we are getting to this situation where there is no statistic at all, and it was a hard point for the management of the crisis because the government did not know how many people in France have any kind of disability. And so to provide support during the lockdown, for example, at territorial level, it was really hard for territorial institutions to know where there is someone who maybe need some support. So we are going to advocate again and again to have statistics, to have figures, also about person with disability, with a gender approach also, in order to avoid this kind of situation where we don't know nothing about concrete situation in all fronts.
Yeah.
Okay. Any other questions?
Sandra. you.
Hello.
Hello. So just not exactly questions, but I want regarding the statistics, for instance. Don't you? I suppose that in France people get the disability pension.
Yes.
Yes. So obviously there is the information there. It's the fact is that normally governments don't cross information and don't try to really know about it, because health services also have this information and social services have it. So in fact, it's just the willing that is lacking, you know, because it's possible. It's happened here. In Portugal, we also have been advocating, but in a different way. We want statistics that are able to tell us the type of disability that people have,
Exactly.
because the type of supports are different.
Exactly.
But we have, in general, we know how many people with disabilities, and also the kind of level of support that they need.
Yeah.
So here in Portugal, so we also have this information, central information, that everyone that dies, everybody that dies, needs to have a doctor certificate telling the reason for the death. So this is why we know how many people died, even if they died in their homes or institutions and not in hospitals. We know if they died from coronavirus or not. Also, one other thing that I want to share is regarding the way that governments are dealing with this. In Portugal last week, they have decided to give 2 million euros to the organizations, so the umbrella organizations that are dealing with people that are more vulnerable, including people with disabilities. And this money is just for training of the support staff that is going to support them now that we are deconfining, and for the protection equipment. So it's not a lot, but it shows that for the first time they are really trying to discriminate in a positive way. So making sure that things get to the people that are more vulnerable. What we had here in what comes to people dying outside the hospitals, most of them died old people in homes for older people.
Of course.
So it was like really, really bad. So like 30% or something like that of people that were in homes died because of the coronavirus. And also we know that if the organizations or the institutions wanted to have people tested, and especially professionals that are giving support tested, they had to pay for it themselves. And this is not admissible at all.
No.
And this happens also for our organizations, of course.
Okay,
so
thank
just
you.
Yeah,
we're running out of time, Sandra.
Sorry. So those are just a couple of things that I've retained from what you said, that it seemed that it were a bit different from country to country. Thank you.
Yeah. Thank you everyone for the questions. Last round for Isabelle and Clara, if there is anything you wanted to particularly highlight or add to the conversation because we didn't cover it so far.
But maybe, Clara, do you want to speak about the bonus? Because just to step on what Clara said. Yeah.
Well, during the lockdown, the government announced that medical staff, hospital staff, care staff will receive a bonus, an economic bonus for their mobilization during the crisis. And Unapei and other organizations, we advocate because we wanted to extend this bonus to the service provider staff and also to social worker staff. And so we advocate a lot, showing how they've done an amazing job. They were also risking their lives by facing the contamination. And finally, the government a few days ago said that the bonus will be extended to service provider staff. So we are very happy, but we will continue the advocacy work because the government did not say nothing about social workers. And from our understanding, they also need this bonus. It's not only about money, about economic, it's about consideration. And public authorities needs to considerate these professionals because they are doing a great job and they are supporting a lot of people in France and in Europe. So we'll keep in touch in this subject, and we hope the government will hear us.
Okay. Thank you very much. Thank you everyone for your participation. I found the conversation very interesting and enriching. So thank you, Isabelle and Clara. It was very, very useful to have you here. Thank you very much.
Yeah.
Of course, we'll be stay in contact on many issues. And before we go, definitely, I just want to flag out some of the work for participants. If you go to Inclusion Europe's website, you can find not only our own work on lately education, for example, in relation to coronavirus, but also plenty of material in easy to read in 18 languages, and the resources provided by others such as Unapei. So there are links to many other organizations and websites. So if you go to Inclusion Europe website, you find the resources there. And the last thing to mention is we are also preparing another webinar for next week, and this will be looking at self-advocacy and how self-advocacy organizations and the movement is doing and how they are dealing with the social distancing and isolation. So please follow our social media or subscribe to our newsletters so you can participate in the next sessions as well. Thank you everyone for participating. Thank you. Stay safe and have a nice day.
Bye-bye. Bye-bye, everyone.
Thank you. Bye.